live meeting in how long, Julia? Oh, well over a year.
Yeah.
So thanks for showing up. We're going to kind of do it kind of hybrid today. We have some people on Zoom and those of us present here. Because it's been a while since we have been in person, we were going to start with introductions today. I am Rochelle Conan. I'm the public defender in Kane County. And I think what we'll do is we'll start with our people that we have here and then go to Zoom. Mike, you want to start?
I'm Blaine. I represent the Kane County Bar Association.
I'm Marcus Clark. I'm from Wabanzi Community College, Adult Education Special Program.
Adam Schauer, Wabanzi Community College Dean for Adult Education.
Josh Assistant, Kane County Regional Office of Education.
Suzanne Martin, Program Manager.
Hi, everybody. Martin Ponte with East Aurora School District 131, Program Manager for C.
Becky Sadler with Rose Prince.
Lorena Nunez with Greater Family Health.
Zach Rose with the National Youth Advocacy Program.
First Sierra with Fitness Coach Kyle Turner.
Do you just want to call people off of Zoom?
Yeah. Okay, I will call the people who I see on Zoom. So I see Robin. Do you want to introduce yourself? So we can hear you.
Sure. Hi, I'm Robin Braza. I'm the coordinator of culture and climate for District 246.
Thank you. Heidi.
Hi, my name is Sadie Mana, MST Supervisor with One Hope United.
Lark.
Hi, my name is Lark Cowart. I am the head of the Abuse and Neglect Unit for the State's Attorney's Office.
Bernie.
Hi, I'm Bernie May. I'm the Executive Director with Family Service Association.
Carly.
Hi, I'm Carly Niels, and I'm the CCBYS Crisis Team Lead for Aunt Martha's.
Everybody's moving around on me. Mirna.
Hello, I'm Myrna Salcido. I work for Aunt Martha for CCBYS. I'm a crisis clinician.
Okay, Deborah. Deb there. All right, we'll skip over Deb, go down to Latanya.
Hi, Latanya Hill. I'm Director for Kane County Court Services.
Marty.
Hi, I'm Marty Nearing. I'm the Executive Director for Student and Family Services for West Aurora School District.
Mike.
Good afternoon. I'm Mike Davis. I'm the Superintendent of the Juvenile Justice Center.
Simon.
Hi, Simon Rodriguez, City of Aurora Youth Services Manager.
I see M. Serrano.
Hi, my name is Myrna Serrano from Central States. Sir, I am Business Service Representative.
And Deb says she couldn't unmute, but she's here. So Deb is the ASA from the Juvenile Division. And then we had Judge Parga.
Yes, and Judge Parga has also joined us. She is the delinquency judge for Kane County. So welcome to everyone. Welcome back. We are going to start with some presentations today from some of our partners. We will begin with Adam Schauer and Marcus Clark from Wabanzi Community College.
Thank you. My name is Adam Schauer. I'm the Dean for Adult Education at Wabanzi Community College. We just wanted to take an opportunity to introduce ourselves, give you some information. I oversee the high school equivalency programs, the English as a second language programs, and Mr. Clark will talk a little bit more about the Wabanzi Works program. We work quite a bit with justice involved youth, individuals that are coming to get their high school equivalency, and just wanted to kind of talk a little bit more about our programs. All of the programs that we offer are free of charge. All the materials are provided for the students. And coming here today and being a part of this organization, our focus is to become more intentional with our referral process for individuals that need their high school equivalency, and to help them as Marcus will talk about, get into some of the various different jobs programs that we work with. We work with Sheriff Kane in providing high school equivalency programming here at the jail. We also work with Sheriff Baird in providing high school equivalency programming inside Kendall County Jail. And the focus is really to help individuals achieve those credentials. An often cited study shows that an individual that does not have their high school equivalency that gets it is 47% less likely to recidivate. And that is our ultimate goal, is to help make the community safer by providing these educational opportunities. And so love to partner with everybody in the room and on the call in any way that we can become more intentional in those referral processes to help these individuals achieve those goals. And I'm going to turn it over to Marcus to talk a little bit about his. Thanks, Ed.
So again, my name is Marcus Clark. I am the program manager for our We Owe a Youth program, Waubonsie Works, housed at Waubonsie Community College. So I just passed out a flyer. And for those that are joining us virtually, waubonsie.edu/freeworks is our website that houses all of this information. But basically, our Waubonsie Works program is a program geared toward removing barriers for individuals between the ages of 16 and 24. Specifically education, barriers to education and employment. So for instance, one of the greatest challenges to education, one of the biggest barriers tends to be the cost of college. So with our program, we are able to provide 100% tuition assistance for individuals who qualify. Along with that, we are able to provide paid work experiences. So these are, think of 8 to 12 week paid internship opportunities for individuals, so they are pretty flexible. The goal is for them to gain valuable skills and competencies that are related to their desired career field. And then specifically, we are the justice involved youth population is a priority population for WIO. So we have been working with individuals in the communities to identify employers who are able to hire individuals with backgrounds. We have a mentoring component with our program. We have a number of referral services, a number of community-based organizations that we work with that provide wraparound services. Along with the program, some other benefits or incentives, we are able to provide supporter services. So these could be things in the form of gas cards, Uber and Lyft rides. We have covered car repairs for individuals. We've paid for utility bills and things of that nature. So really anything that is considered to be a barrier, again, to education and employment, that is where we can come in and alleviate those barriers. So lastly, I'll just kind of highlight just some of the eligibility requirements. So on this flyer, you can see it's articulated an individual who's between the ages of 16 and 24, currently out of school. And the definition of out of school is someone who is pretty much done with high school. So whether you graduated or you withdrawn from high school, and then you have not yet registered for college credit courses, and then an individual who's eligible to work in the United States. So that's the preliminary criteria. And then there are basic criteria to get you in. So for instance, an individual, again, who has been subject to the justice system, an individual who's pregnant with parenting, an individual who has dropped out of high school, an individual who has a disability or an IEP. So those are all ways to get an individual into the program. And again, we're here just highlighting the benefits of the program, but we are moving toward working on a pilot that involves justice involved youth. So again, our goal is to provide a pathway so that individuals can come take courses at Waubonsie and then transition into an employment opportunity, along with getting some of those benefits of those supportive services. So my contact information is also on our website, waubonsie.edu/freeworks. And then I have also just left some cards here. So if you are interested in learning more information or just partnering with us moving forward, please feel free to contact. Yeah, sure.
So how many of the employers who participate in the program accept youth with justice system history?
So we almost have like a vetting process, a screening process in a sense. With our paid work experiences, we can customize those based on the need of the individual as well as the need of the employer. So going back to your question, anyone who's coming into our program, our number one priority is to provide them an avenue to employment. So we're removing those barriers along the way. So we've identified dozens of employers within this area where individuals are able to, like, let's say, for instance, I'm coming into the program and I have no work experience at all. So we have a group of employers that we work with that will house, me and other individuals such as myself who need some just basic employment skills, soft skill development, things like that. Say, for instance, we get an individual who comes into the program and they have a little bit of work experience, and maybe they have a background. So we're able to kind of customize what that approach is based on what the specific need is of that individual. And then we're always open to working with more employers. There are no limitations on that. So we have an employer partner program, so we have employers that we work with consistently. And then again, we're always working with individuals. Sometimes it's a medical setting. Sometimes we have also positions available over at our Sugar Grove campus as well as our downtown campus as well. So, again, in a nutshell, as we work with individuals, we're identifying there's a needs assessment that takes place. We're identifying some of the challenges that they're facing as far as employment, and then we try to position them into a paid work experience based on their future.
We are working with the One Stop located in Batavia and IDES to identify more employers that are background friendly. We are finding that as their employment needs and their staffing needs are becoming excessive, that they are becoming more background friendly. So we are seeing a bigger increase in employers that are reaching out to us that are more background friendly.
Any questions for me? Thank you.
Thank you. And for those who are on Zoom, we will get you, we'll email out copies of the pamphlets that the speakers have brought today. So our next presenters our next presenter is Marty Nearing of West Aurora School District. I believe Marty's on.
Yeah, Marty's on Zoom, but before Latanya has her hand up.
Oh,
sorry, Latanya, I just saw it.
I'm sorry, I just had a quick question, only because I'm thinking about it from the perspective of making referrals, or my probation officers making referrals. This program sounds, and I heard you say that you work in conjunction with other local programs. What I heard you speaking about sounds a lot like the programs, the community agencies that work through the workforce development. So like Central States and the LIGHT program. Are those programs you work in conjunction with, or is this separate? How is it different than those programs? Just so I can try to think about it from a referral perspective, if that makes sense.
Yeah, so the programs that you just mentioned, they are also a part of our entire network, serving the Kane, Kendall, and DeKalb County areas. So a lot of times what we will do, if we're working with, like, for instance, each provider has a specialized service in a sense. So sometimes as we're working with individuals, just to avoid duplicating services, we will make referrals to individuals in our network. But yes, these are all WIOA youth programs, and they all fall within our network of Kane, Kendall, and DeKalb County areas.
Okay, thank you.
Anybody else have any questions? Okay, then we can thank you very much for coming and speaking, and we can move on to Ms. Nearing.
Hey, everybody. It's been a while since I've been with this group, and so I'm excited to be back. I promised Julia that I would make every effort to be at every meeting moving forward. So here I am. I was excited to see the hybrid model. I really don't have a presentation so much as I just kind of wanted to share a little bit about what District 129, and I think probably many schools, are going through just with the COVID issues this year. So I'm the director, or the executive director of Student and Family Services, and my boss asked me yesterday, he's like, what's getting in the way of you doing all the things that you normally do? And I said, COVID is getting in the way. I think we probably all feel very similar, right? So I just wanted to share some of the things that we're doing this year to really try and keep kids in school as much as possible. We have 3 testing clinics or protocols going right now. One is for students who are symptomatic with COVID-like symptoms. The other is for our staff who are either non-disclosed or unvaccinated, so that we can make sure that we're getting them into our classrooms to be with our students. And then most recently, we started the test to stay protocol, which gives us the ability to, when we identify students who are close contacts to a positive case, to get consent from their family and test them on days 1, 3, 5, and 7, so that they can maintain school attendance as long as they continue to be asymptomatic. And so, you know, we have a pretty transparent website, and things have flipped from last year. So this year we've had, out of our 23 buildings, we have had only 20 positive staff cases, which is fantastic because we were well into the hundreds last year. And then of our 23 buildings, we've only had 173 positive student cases. With our test to stay protocol that we just recently put in place in the last week, we've been able to keep 47 students in school that would have been quarantined for up to 14 days. So we're really excited about that. You know, some of the challenges that we've had, just so you guys are aware too, some of the transportation companies are unable to hire drivers. So some of the people that we've contracted services with have not been able to provide those services. And that includes our taxi companies who are vital to our McKinney-Vento, our homeless transportation. So that's been, we've really had to tap parents and use those gas cards and ask parents to drive their kids to school from outside of the district in order for them to get here. Substitute teachers also have been a challenge. So some of our professional development efforts that we had planned for the school year have had to be put on the back burner just because we don't have the substitutes to go into classrooms to cover those teachers for professional development. Just a little bit back to testing, we are using the Bionex Now testing method, which is the nasal swab that you get results within 15 minutes, as opposed to some of the other schools, I think, in the area that are using Shield, which is a saliva test, where results are 24 to 48 hours out. So we're hoping that we're catching some of those positive cases as quickly as we can to keep our buildings safe, so that we can get kids in school. Are seeing a lot of dysregulated students. Attendance has been really difficult. We've had a little bit of an uptick in some of our verbal and physical aggression. So trying to put some efforts in place for that. And then we have vape sensors in our high school, 6 of them that we piloted a couple of years ago. So when kids are vaping in the bathroom, our administration is notified, and I get those notifications as well. My phone is on fire, like draining the battery every day. So just some of the things that, you know, that we're seeing that are just potential barriers for kids in the educational environment. So thanks for having me here.
Any questions for Ms. Neering? Thank you for coming and speaking. Our next presenters are Carly Nell and Myrna Salinas from Aunt Martha's Health and Wellness. Sorry, Ms.
Hello.
Salinas.
That's okay. Hello, my name is Myrna. I work for Aunt Martha's. We work for CCBYS, Comprehensive Community-Based Youth Services. Work with youth ages 10 to 17 and their families who are experiencing conflict and stress. We are committed to provide intensive intervention service in Western Cook counties, Grundy, Kane and Kendall, Will, and Vermilion counties. What we do, our services is we do crisis response and interventions. We do screenings, assessments, we work with individuals, family, group counseling as a DBT or Sparks group. Excuse me, Aunt Martha's also offers substance abuse treatment, primary care service, psychiatry service, supportive and housing and Workforce Development Service. When we work for school districts. They send us the referrals for social workers, counselors, to have for care treatment for one of their students. We do individual services, and some of the times we have a group, and we offer them for 90 days, once a week. It could be between 10 to 12 sessions. Each of the group's curriculums provides skills development and self-awareness in order to assist the youth struggling with any hardships. Or group with facilitators are companion and trained professionals who are passionate in the field, adolescents, crisis interventions, and counseling. And we have crisis responders when they call us from the police station, hospitals, for any crisis the youth is going through. We respond for those calls. We go and meet with the youth, let's say in the hospital, and we investigate, to make sure to see what's going on with the youth, what's going on with the family. Our goal is to reunify the family. We try to avoid the shelters for the youth. Our goal is to have the youth safe, the safety, even with the family. There's a lot of circumstances that the youth don't feel safe at home for any reason. We have to contact DCFS so they can do a little bit more investigation with the family. We want the youth to be safe all the time. Some of the times it could be for lockouts that parents, they don't want the youth back home because of the behavior. We respond to those calls as well. We try to investigate and reunify the family. Like I said, we try to avoid sending the youth to shelters. So actually, that's pretty much what we do in our agency with CCBYS.
The way I like to describe our program is kind of like a DCFS buffer. So we do a lot of preventative measures in the school. We run groups, we do individuals. And then, when a crisis does eventually happen, we do respond out, but we try to avoid DCFS getting involved unless we really have to. So, because it's never fun having them involved for an extensive amount of time. So yeah, that's kind of what we do. Any questions?
Doesn't look like there are any questions. Thank you so much for coming and speaking. And our final presenter today is Lorena Nunez from Greater Family Health. Well, thank you, everybody. I'm excited to be here. So one of the reasons why I wanted to do that today is because Greater Family Health just recently went through a name change. So we were formerly known as Greater Elgin Family Care Center. Many of you may have heard of it. So we did it for many different reasons. One, because it's an Elgin in the name, and we're not just in Elgin. We have 9 different locations. We have locations in DeKalb, Sycamore, McHenry, Elgin, Streamwood, Hanover Park, and Wheeling area. I'm going to pass it around to brochure. And then I'm also going to pass around a sign-up list in case you're interested in receiving some of our updated material. I do have some with me, not enough, so Anita just let me know. So I just wanted to do an overview kind of all of the services that are available at Greater Family Health. So we are a federally qualified health insurer, and we provide healthcare and other options for the community regardless of ability to pay. So it doesn't matter if you have insurance or if you don't have insurance, you're able to access these services. And we want to make sure that even if you're not able to pay for these services, that you're still able to access them. So we do provide medical services, primary care services for babies all the way through older adults, from pregnant women all the way as well to the LGBTQ community. We provide dental services for adults and children as well, and behavioral health services. Under behavioral health, we do counseling and psychiatry. We do individual, group, and family counseling and psychiatry services. We do also have substance use disorder services, which are available for those who are 18 and up. So we do have the medication assisted treatment program, which is for opioid use disorder treatment.
And we also have a peer recovery support option as well. So you can meet with someone who's already kind of been through the recovery process and kind of coach you to guide them in their recovery. And we do also have smart recovery groups. They're currently on pause right now because of the pandemic, but we're looking forward to having those very soon. And again, as I've mentioned, regardless of insurance status, regardless of ability to pay, we do accept Medicaid, Medicare, as well as some private HMO and PPO plans. For those who are uninsured, we do have a sliding fee discount, and the full discount currently is only $25 for most of our services, actually all of our services except for dental services. For dental, it's a little bit more, for adults 50 and children 35. But with this, we do also do our best to make sure that if our patient is eligible for insurance, we help them apply for that. So we do have health benefit specialists at our health centers. It is available to anybody. They don't have to be our patient. They can come. Their appointments are available. So they can always do that. And the open enrollment season is coming up. So I wanted to make sure to mention that. And they can just call the number on the brochure to be able to make that appointment. We do also have transportation assistance, so that could be us working with their insurance or doing transportation cost reimbursement. So we do reimburse up to $10 each way. So if it's $12, then we would cover the $10 cost, and then they would just be responsible for $2. And I know, that one of the things that we try to do is remove barriers as a federally qualified health center. So translation services are also available. If they don't speak English, whatever language they speak, we do have professional translation services, which have a long list of languages available. But our staff is also bilingual. So for example, our call center staff, our receptionist staff are all English and Spanish speaking. Our medical assistants are also bilingual, and some of our providers also speak sometimes 2-3 different languages. Worst case, we use a translation services, which is still not even a worst case. We do have video or telephone, and it's professional medical person who's able to help and translate accurately for them. And we do also have a lot of caring case management programs available for medical services, for pregnant mothers or families with a young child that find infants under 1. And also those who are HIV positive as well. So they're able to work with the case manager and kind of get those referrals that are needed. We do also have discounted pharmaceuticals for eligible patients are able to use that discount if they're not able to afford medications. We're able to connect them with that. And I don't know how long I've been talking, but if there's any questions, I can take them now. Thank you.
Any questions for Ms. Nunez? I don't see any hands up online. Thank you very much for coming. One of the things that is a goal of our council is to connect our community partners with one another so that everyone knows what everyone else is providing in services, and there may be something that you're lacking in your agency that another agency may be able to provide. So bringing in the community partners to give these little speeches, we feel is very helpful for everyone. And so if you are interested in doing a presentation at one of our upcoming quarterly meetings, please let Julia know, because we do find these to be very beneficial, and the information is really good for all of us to have. So thank you all for coming and speaking today. Okay, so we can move on to the rest of our meeting. Our first item is we do have to do some minor upkeep issues, approval of our meetings from September. We do, I believe, have a quorum, correct, Julia? Okay. So I know that Julia sent out the minutes of our September meeting for the board of directors. I would just ask if anyone has any comments on those corrections or additions. So seeing none, the minutes from September will be passed as handed out. So our next item of business is the chairman's report. Generally, we do a financial statement. However, the state's attorney is in transition with their financial person, so we do not have an update at this time. but hopefully we'll have that next month as that new employee gets acclimated to their new position. Our contract for the Juvenile Justice Council has been signed by the county board and has been passed on submitted to DHS. So we are able to continue doing business. Also, we are currently working on the statute for a Juvenile Justice Council includes that on our board of directors can be a county board member. We have been for a while now trying to obtain a county board member to come and be a part of the board of directors. We are currently still working on that, and hopefully we'll have someone very soon. And we can move on then to old business, which is an update of our priorities and things that we have been working on. The first kind of dovetails into the county board member. Based upon the statute for the Juvenile Justice Council, it also allows for youth representation on the board of directors. And at our board of directors meetings, we have been discussing this recently of getting youth involved and being a part of our board. One of the issues that was raised, or one of the concerns, is the confidentiality of juveniles and their involvement in the juvenile justice system. Julia did reach out to our commission and got some guidance, but it kind of goes against what we were talking about. The commission indicated that when we bring youth into the board, that it should be up to them as to whether they want to divulge whether they've had past contact in the juvenile justice system. And certainly that is a fair take. What we thought of the board, what we had discussed was that more beneficial for us and understanding youth and what we do as a board would be to have someone on our board of directors who actually had some court involvement. Because they would be able to give us insight that maybe none of the rest of the board of directors would have. So that was the discussion where we were at. So we are continuing to work on trying to find a representative of youth who would be open to being a part of the board and hopefully would have some past involvement with the juvenile justice system and would be open to sharing that with us as well. Any questions about that? So our next item of old business is restorative practices. The Juvenile Justice Council did fund some training of the trainers for restorative practices, and those people are currently working on completing I'm sorry, let me back up just a little bit. As part of that funding, they entered into memorandums of understanding that they would perform certain number of trainings in the community. And those people are currently working on those trainings. So we just wanted to put out that we do have people in the community that are doing that. If you are interested in having that type of training for your agency, please let Julia know. Because we have a number of trainers that have to arrange those trainings, so we would have availability for your agency if you are interested. Julia also is meeting with the parent council through the Kane County system of care because the parents there have expressed interest in restorative practices, so she's going to be meeting with them in regards to that as well.
Can you explain what you mean by restorative practices?
Julia will do that better.
Thank you. Put me on the spot. So restorative practices is sort of, it's a framework, or it's creating a culture. It's not a program. It's not a one and done thing. It's really about creating a sense of community where everyone is connected and there's relationships that are established so that when harm occurs, you can repair the harm within that community and essentially restore the harm that was done within that network, rather than having to sort of do things to the individual or punish them. That's in a nutshell. I mean, does that help?
Yes.
Okay.
I mean, just for people who haven't been a part of our regular discussions on that, how could they fit into that if they weren't interested, or how would they know whether their agency could be an important component?
Yeah, absolutely. So thinking about Kane County as a whole, of course, we want agencies and organizations to be familiar with restorative practices, to be thinking about how they can integrate it into their organizations within themselves, but know that in the state of Illinois, so what kind of kicked off this whole effort with restorative practices was Senate Bill 100 getting passed years ago. I think it's going on like 5 or 6 years ago, right? And so it talked about schools utilizing more of restorative justice or restorative practices as opposed to discipline measures that were pushing kids out of exclusionary discipline measures that were pushing kids out of the schools, rather handling it within the schools. So we knew that our school districts were going to be doing some of this restorative practices trainings. We've had a lot of conversation with them over the years. They're continuing to do training. They're continuing to do PD for restorative practice. So as community organizations and members, our hope is that we can continue to expand it out into the community, because we know that our kids are out in the community as well, not just in our schools and in the homes. And so really, we're just trying to kind of educate and talk about restorative practices and think about how we can be utilizing it across our entire county.
And Julia, do you know how many meetings our trainers have done already? I know one was done at the youth home, correct?
Yeah, so they were doing more informal trainings within the detention center, but they were trying to just start to talk about it with detention staff. And so it's an ongoing thing. It's an ongoing learning process. It's not going to happen with just one of these trainings. So it's been really helpful with them, but I know that there's other trainings that are happening across districts in the community. And I think there's some other community organizations that are doing them as well.
Anybody have any questions about that?
No, I just, to affirm what you said, Marcus and I participated in one of the restorative was very, very, very good information. We've begun bringing some of the training into what we do at Waubonsie, and obviously would like to, we've talked previously, we just haven't scheduled it about bringing it for the instructors in our programs to get a better knowledge of it. So it is a very eye-opening experience, and we found it very valuable. So thank you very much.
Well, that's awesome. So yes, definitely reach out to Julia, because we have a number of trainers that are ready to be able to do that.
And they can do it either virtually or in person too. I'll just throw that out there as well.
We're also, are we going to do another training for the trainers?
We did that in the summer in June. Is that what you're talking about?
Or did we say we're going to do it again next year for this year's budget?
We didn't, I don't know that, I'd have to look. I don't think that we allotted money for it, but I know there was discussion if we should, or we wanted to see how this year went potentially. So yeah, I mean, there's consideration for that.
All right, so our next item is we are also doing a law enforcement training. Julie, I forgot, what was the date?
December 20th and December 21st.
And the JJC has allotted for 30 spots for that. It is for SRO officers, so those are the officers that are in the schools. And we have confirmed that it will fulfill some of their training requirements. So we're hoping to get a good buy-in right now. As I said, we have 30 spots and we have 7 registered right now. So hoping to fill our 30 spots, because we think that this is going to be a very beneficial training for them.
So, and if I may, the training just for the good of the group is called, gosh, what is it called? But it's from Strategies for Youth. It's Policing the Teen Brain. Sorry, there's 2 teen interaction trainings that we're familiar with, and I always mix them up. But this one's called Policing the Teen Brain. So it's really hitting on how to improve interactions with youth. We know that youth are going through their periods of development, and that can be challenging at times. So hopefully it'll be helpful to the officers to think about other ways to interact with them, or to have some considerations when they're encountering youth in the community.
I'm going to come back to the vote. I'm going to skip over that and we'll come back to it. Expungement packets. As many of you may be aware, we have created an expungement packet that we have been using for several years now. And it gets updated every time the statute changes. This year, it wasn't changes necessarily in the statute, but the Administrative Office of Illinois Courts has mandated standardized forms. So it was necessary, part of that was expungement too. So expungement, the paperwork that you turn over to the court has to be standardized now. So we did change the expungement packet. We have taken down the expungement packet from the website. So if you are looking for it there, it will not be there for hopefully just a short bit of time. But we completed the changes that needed to be completed and have turned it over to the circuit clerk's office for them to look at it to make sure that we did it all correctly. Once they sign off, we will be able to put it back up on the website. So just wanted to let you know, if you're looking for it there, that is why. Any questions on that? And so then we can talk about racial and ethnic disparities. This is
skipping over the vote.
Oh, I can come back to the vote, yes.
Oh, I didn't know when you're gonna.
No, we can do that now. Okay, so we do have one order of business to take care of today, and that is the vote. I would just ask if I can have a motion and a second to discuss this, and that is the Board of Directors approve the final draft for the 2 family court guides.
I'll motion.
And do we have a second? Thank you. So just as a little background, this was something that Judge Parga initiated, and that is to try to have guides in court to kind of explain to juveniles, their parents, as they come into the court system, different terms that we use in court that aren't necessarily terms that people hear generally in public, but also to give them a guide or a roadmap of what to expect when they come to court, when their child is brought into court, is held in detention, or is charged as a juvenile. So there was a committee that created these 2 guides. One is for delinquency and one is for abuse and neglect. And those, the goal is to have those available in the courtrooms. And also, I think we talked about putting them out through probation and to any other agencies too that would like those with them, just to kind of give the families a better idea of what to expect.
I just have a quick question. Is there plans to have these documents translated at all?
You know what, we did talk about that a little bit.
So we did, yes. And that was one question I was going to have as well. And I thought maybe we could try to ask Callie at the law library if they would be able to help us translate them into Spanish as well as English. So yes, they should definitely be.
This vote is just to approve the actual content. So once the content's approved in English, then we can get it translated.
So do the Board of Directors have any questions or discussion on those? So then we could put it to a vote of the Board of Directors. All in favor of approving the final drafts for the 2 family court guides, please say aye.
Aye.
And any opposed? So that has passed, and we will, as indicated, those will now be the final drafts, and we will work on getting those out then. All right, so we can move back to racial and ethnic disparities. Do you want to talk about this one?
Yeah, so we have an RED team that meets quarterly. And so it's with members of the Board of Directors, the RED standing for Racial and Ethnic Disparities. And so they met in September, and we took a look at our RED plan, which I'll share with you when we get down to the JJC material, so you all can kind of take a peek at what that looks like, what they're working from. But we just looked at it as our first meeting for the fiscal year. Took a look to confirm whether or not how it was written, because it was written back in May, and here we are in September. What adjustments need to be made or what steps we need to be taking. going forward. And so kind of the consensus being a couple of things. One, we're going to look at how we can start to map out some of the data that we're seeing to see if we can be more targeted in our efforts to intervene or to do some outreach. And then the other thing being that we want to do a more updated, complete data set, because the current plan is based on 2018 data, which was the last relatively complete data set that I had access to. So I'm trying to get 2019 data right now to update the plan to see if we've had any improvements in some of the trends that we're seeing, because there were interventions that were put into place sometime around 2018. So we want to see if any of those things have started to shift the numbers. And when I'm talking about our data sets, what I'm talking about is the decision points that we have to look at across the juvenile justice system. So when kids come in at arrest, diversion, I'm not going to remember all of them, arrest, diversion, there's a time, I think.
Sentence to probation, sent to IDJJ, automatic transfers to adult court.
Yes. So we are going to try to get some of that more updated data to make the changes then to our plan as well. But that was sort of our next step out of that meeting in September.
Anybody have any questions on that? Oh, did you want to talk about the?
Yeah, so I just thought of another thing too, with relation to the RED work. I also participate in the statewide RED committee through our funder. So just for, again, the good of the group, I've been keeping the board apprised of this, but that group is working on sort of looking at some of the data collection efforts, seeing how we can maybe get, take a look at the data statewide, helping jurisdictions with taking a look at their data, making sense of the data. That's really a main priority. And then once sort of those data collection efforts are moving along, then we're going to start to be more targeted in potentially looking at certain jurisdictions that have higher rates of disparities or areas of concern to intervene. The other sort of, it's related, but it's kind of pushing off into its own, is the adolescent domestic battery work group. So we have a work group of stakeholders who are coming together to talk about the issue of adolescent domestic battery, because our data has shown that this is one of the most prevalent offenses really across the decision points, with the exception of arrest, because we struggle to get arrest data. So I don't want to speak to that or mislead anyone, but I would anticipate, it's in there if it's across the rest of the decision points. But it was the second highest offense for youth coming into detention. And of course, we don't want youth being detained if we don't need to. So we are taking a look at this issue. This work group has come together to try to prevent kids from coming into detention. We know that it's a challenging issue because a lot of times in those situations, families, it may require the removal of the youth and we don't really know where to put them. So we're having some of those conversations and then thinking about how do we ensure that these families are getting access to the resources that they need to prevent these things from occurring again.
Is that Martha's on that working group?
So we have not, so right now it's just been representatives sort of from the justice system, and then we're kind of talking about it, and then we're talking about expanding it out. But Aunt Martha's is one of the stakeholders we're looking to engage at some point. Yes. So Aunt Martha's on the call. Sorry, Ricky, go ahead.
I have a question, Ricky Rogers, African American Community Unity. My question is related to what agencies are providing some of these interventions for youth?
What interventions are you referring to?
Well, you had mentioned about earlier that you're doing statistics and data to see what interventions have been in place and effective to curtail those numbers. Mm-hmm. And so what I'm asking is what agencies or organizations are providing services or interventions so those numbers can decrease?
Yeah, so I think I'm using the interventions term in more of like the general sense, not specifically into like programmatic or clinical interventions per se, but there were some just opportunities. So like, for instance, we saw that a high number of kids were a high number of kids were getting arrested for, or getting detained for warrants, right? And so court services then implemented a new policy or protocol to make reminder phone calls before kids are coming to court, to give them that reminder so that they're not missing their court dates and then inadvertently getting that failure to appear warrant and being detained subsequently. So those are sort of the interventions, more so on a broad scope that I'm referring to.
Okay, thank you.
Sure.
Any other questions on that?
So have we developed, or are we trying to identify what interventions are going to be used in domestic battery cases before kids are actually arrested on the charge? I'm not really clear, and I'm not really following.
Yeah, I can answer.
You want to go ahead?
Yeah. So I was on the meeting just this week. And what we're looking at now is the statute itself, the domestic violence statute itself, and whether it should apply to juveniles. And so it may be a legislative ask to have them removed, and it would just, in juvenile court, would just be a battery and not a domestic battery, which would alleviate the 72 hours and would alleviate the need to detain them for the risk factors that get them detained. So we have been talking about that, and I forget, Tanya might know, the one that Lisa was talking about.
Talking about the typology.
Yes, the different risk assessments that potentially could be done. Because one of the things that we talked about, because this week at the meeting, we were talking about what happens in the when they actually get to court. And one of the things that was brought up is that, you know, that a lot of these kids are being released on the day at the detention hearing. A lot of times by agreement of the parties, they're being released. And at that time, we don't really have any idea of what is going on with that family. You know, a lot of times the parents call the police, they want the kid taken away. And then from an attorney point of view, the day of the detention hearing, then it is, well, they didn't really want the kid detained, and this is all the police's fault for arresting them. So we talked about that we don't really know what's going on with the family dynamic or the issues or services that would be helpful to that family at the time that they show up in court. And so we talked about different assessments that could be done that would give us more of an understanding at that point in releasing of what services the family would need.
Well, the reason I mentioned that, Martha, is, I mean, back when I used to do a fair amount of juvenile cases, I don't do them now, so I could be, you know, could be old, but we used to have these situations where the explanation would be, well, we had to keep the youth out of the house, and the only way we could really do that was to arrest them. But my experience had been that if Aunt Martha's was called, 9 times out of 10, Aunt Martha's worked out, you know, get Aunt Sally or even a neighbor or a best friend's parents, somebody responsible adult that everybody could agree upon, it would take the youth to their house. And then there would be no arrest, and you'd have a cooling off period.
And that's part of the problem with the statute. The statute does not give police officers that discretion and to avoid liability on their part for them to try to find other arrangements for the youth at that point. So that's kind of what we were talking about, legislative fixes to the statute itself.
So when kids do come into court on the domestic battery charges, the attorneys are really good about figuring out why, what has happened. And very often it has to do with mental health issues. And so the attorneys will tell me, you know, they are not taking their meds, or their meds aren't working, or, you know, they're really good about answering that question of why. And so then for us in court, it is trying to plug in services, because if I hear that, I'm absolutely going to order counseling as a condition of release. You have to take your medicine. You need to go see a counselor. When's the next appointment? So it seems like the issue really is more in then that step from there, because they are coming in. It would be great if they didn't, if they're, you know, through the statute, it could be handled like Mike is saying, or, you know, they were rerouted, but they're not. And so I think everybody in court is really good about figuring out the why. Really, the problem comes after we found out why, because getting the kids into services is the biggest problem. The wait lists are so long. I cannot get services for kids. They're waiting weeks and weeks and weeks. So I send them home hoping that they're going to get an appointment, and I keep coming back and they are sometimes unsure where to go. If we have connected them with someone, there's a very long wait. So really, we're just hoping it doesn't blow up again in the meantime. But that's really where the problem is. And I know it's a lack of, you know, we don't have enough of the services, but to me, that's really where the issue is. It isn't the why. We have found out why in court. Either the parents have shared with the attorneys or the attorneys found out from the child. We know why. It's what happens after that that's where everything falls apart.
And I think that's a part of what we're discussing at our next meeting. That's kind of where we ended this meeting. And hopefully we'll be able to address some of those issues with our next workshop. Questions on that?
I just want to add that, you know, a kid may not always need counseling. You know, other alternatives would be, you know, mentoring services. They can help with substance abuse, so they can help with issues associated with violence. They can come up with peaceful solutions. So mentoring may be an alternative, whereas they don't have a long wait to actually start receiving services. And so African American Community Unity, we will be readily available to start accepting youth that's interested in being a part of our program and going through what we call a rite of passage, which is also a best practice approach to helping at-risk youth get on the right track, socially, academically, as well as economically.
I also just wanted to add, when we do respond out to crises, one thing we do see is, like, obviously we're working the case and we get them, you know, either in a family generated placement or home or in a shelter for the cool off period. But we do offer services. We have no wait time. We are fully open, and these kids refuse, and we can't force them to have services. So that's a lot of the things that we're seeing, is that they're not really receptive. And like I said, our services, we can go to the park and, you know, play catch with the baseball and just talk. So it could be as casual as that, or in a office setting. It's up to them, but they still are kind of disinterested because I feel like they associate it with the crisis situation. So.
Yeah, I think offering different choices to the families or the kids may be a viable option as well. You know, instead of just saying one or two, it's 3 or 4 or 5 or 6. And so giving them, you know, different opportunities. And I'm certain that if they know that, you know, our program is culturally based, and of course, if there's a disparity and there's some inequities, and if they know they can get services from an African-American organization, they may be more prone to actually adhere to some of the methodologies that's actually utilized to transform thoughts and behaviors.
Any other comments? Oh, we got a question.
So the program that I kind of oversee is CDAC. So we deal with students who have been exposed to violence. And part of the program has to do with counseling outside school. And then we also do mentoring for the kids in school, during school hours. So yes, it's kind of been very, very tough for students to recognize that they need counseling when they're older than 12. And the other obstacle that we see is parents willing to follow the steps to get counseling. So it's like the service was being offered, is being paid, no charges to them. And it's just kind of getting the student to agree that counseling is needed. And then the parents following the steps to get everything ready for counseling by whatever means. I'm talking about transportation, talking about, taking all the barriers, removing all the barriers, and it's getting tough. So what it seems to be working really well is mentoring. So we kind of been seeing the students like in a weekly basis, taking them out from the non-core classes and kind of just sitting, talking to them for a bit. That seems to be working really well. Getting half an hour.
Thank you for all the comments on that. Anything else on that? So we can move on. There is a RED conference that is happening on November 2nd and 3rd, and the council has allotted 10 spots for that. We have 5 of the spots filled. So we are opening it up. If anyone else is interested, please let Julia know by the end of today. She does have the agenda and can share that information with you if you are interested. But that is November 2nd and 3rd, and it is completely virtual. And next is the wake up call. The wake up call, we are hosting in collaboration with West Aurora. The date has been set for January 25th of 2022. For those who are unfamiliar with this, this is something that JJC co-sponsored with in years past. I forgot, how many did we do?
It was 4 other districts. I think it was 5 events in total.
And so it's a presentation for parents to sort of wake them up as to the different things that their children can do to hide drugs or alcohol use. It was very well received in all of those districts, and the parents were shocked at what could be done to hide those things. So this is something that we're happy to be sponsoring again, and we will have more information on it as we get closer to that date. And then Julia is going to talk about our the JJC survey that was done and our information on JJC.
All right, so I just wanted to take a minute to share with the council about some of the materials that we have to submit as part of our grant application to sort of help you make sense of where all of this comes from. It's not just Julia making things up, that it really is based in the data, both quantitative and qualitative. So this conversation that we're having about some of the needs and trends that are coming up in your work, that's all getting in my brain at least. And so then when comes time to do the grant application and we take a look at these materials, that's where all of that goes. And so the first document sort of in this range of materials that we had to submit was just the analysis of juvenile delinquency problems and needs in our community. And so some of that comes from, if you remember, we administered a survey to law enforcement last year, during the fiscal year last year. So there's some data that we collected from that. Of course, our decision point data as well. And then just, I've been doing some one-on-one conversations with the members. My time is not allotted me to be able to do that as much as I'd like to at the beginning of this fiscal year, but that's given me some information as well. So really what I did was sort of capture some of the problems and needs that I'm hearing at the different decision points. So you see these, when I talked about that data set earlier, these are the decision points that we have to collect data on and take a look at where we might be able to intervene. I'm not going to read all of these to you. I know it's fine print. I can send these out after the meeting so you can take a look at them. But I just wanted to do a quick walkthrough and sort of let you know how they all start to communicate to each other. And so we've got our problems and needs at each decision point, both from the different sources of data, and then those potential implications that may come up. And so then there's some other additional problems and needs that I've heard, just generally speaking, that don't necessarily connect to the decision points that seem to be pretty prevalent going on. So we do this delinquency problems and needs, and then if I can move over, then that informs the, I don't know if folks, if it messes up my screen share, if I'm between documents, so I apologize. I'm gonna excuse my fumbling here. All right, so then that informs our JJC plan. So of course, these aren't all of the problems and needs that come up in our county. They've been narrowed down just based on what we've heard or based on what the data is saying. Then we narrow it down even more into our JJC plan and sort of prioritize what it is that we want to work on. So one of the biggest issues that we've been talking about with arrests, for example, is that we don't have this mechanism to be able to collect arrest data at a local level in Kane County. We have, I think it's 26 jurisdictions in Kane County for police departments. So we don't have a common mechanism to gather that information. And so we don't really know what that arrest data looks like. So this is kind of talking about how we might be able to move forward with that with the goals. So these are where our JJC goals for the fiscal year come from. They're based around that juvenile needs assessment that's done and then put into this plan. Then again, I'm going to send these out to you, so I'm not going to go into it too in depth. Then we have, based on the JJC plan, and I'll make sure that folks can see it on the call. Then we have the RED plan. And so that RED plan, there's in the JJC plan, there's discussion about how we're going to address RED. Part of that is through our RED plan. So you see there's some different informational things, but then we start to see where we've got the actual data collection going on, what our efforts are to collect that data, where some of those disparities are, some of the trends, the concerns. Again, remember I said this is based on calendar year 2018, so it's a little bit dated. And then we get down to there may be some supplemental data, and then this is where we get down to the quote unquote interventions, not to be confused with clinical or programmatic interventions, but ways that we can tackle or target some of these issues and make some changes, whether it be policy level, procedural changes, those sorts of things. So that informs the RED plan. And then the last component that we had to put into our grant application is we had to identify a challenging issue. And so again, I don't know, I'll do one more screen share. This is the last one I'm going to share. So so the challenging issue, of course, that we had some that we could select. Adolescent domestic battery just happened to be one of those, and so it kind of worked nicely and aligned with some of the discussions that we were already having. So this sort of spells out why we chose this issue, why it's such a concern, the data that we were seeing, again, different levels of data, and then sort of our implementation plan, which is what we are doing with our adolescent domestic battery work group. Any questions about the JJC materials? Again, just a brief overview. I will send them out to everyone after the meeting. But I just wanted to give you a walkthrough and sort of let you walk through map out how all of these pieces come together. So there is some method to the madness that occurs at the JJC. The other, sorry, I didn't even pause for questions. I'm just rolling.
Not necessarily a question, Julia. I just wanted to comment that I think it's good that you'll be sharing a plan with all the members that attend this group, just so they get an understanding as to why we have the subcommittees that we have, why we picked the topics or goals that we have each year based upon what the commission is asking us to do, because it's all based upon the data that's represented from our county. And I think that's just good. And I'm glad we went over it in today's meeting and they can see the fine print that ultimately the topics, the RED plan, the adolescent domestic battery, court services trying to assist with warrants, because warrants was one of our highest number of detainees, is really why we're doing what we're doing. I think sometimes we get so caught up in just doing. I think it brings us back to why are we establishing the goals and taking the steps that we're trying to take for the juveniles in Kane County.
And so kind of to connect then to all of those pieces, you all should have received that link to take the survey at the beginning of the year in relation to the JJC structure. We administered one to both the board of directors and then to the general membership as well. And so looking at those results, just to sort of summarize, there's definitely some opportunity area, this being one of them, that members didn't feel like they were aware of how we identify our goals and are aware of how the efforts of the JJC are really informed. And so that was sort of the reason for going through this and making sure that you all are apprised of what we're doing. But also there's some additional opportunities that Rochelle and I are going to be meeting about to make some recommendations or proposals to the board of directors to determine if we need to, restructure or make some adjustments in how the JJC currently operates, just to continue to refine our efforts and make sure that our relationships are strengthened and that we can all work together as really a multi-system entity.
Any questions on that? Okay, then we can move on to new business, just a couple of things there. The first is bullying materials. So in the past, the JJC had purchased a large quantity of bullying materials. So they're printed materials that we were going to use to pass out at different events like National Night Out. We do have a pretty good stock of those right now, so we just wanted to bring it to the full council. If anyone would be interested in some of those materials to use at your agency to pass out schools, or I don't know if we have anybody on from Gail Borden or the library. If you are interested, contact Julia so we can see if we can get those out to you. I am going to let Julia talk about the next one because she did speak to Dr. McCall about this one.
Yeah, so Dr. McCall is from West Aurora School District. She is, I'm not going to even try to give her title, and if Marty wants to chime in on what her title is, but she coordinates a student equity advisory council. And actually one of their students came and spoke to our board of directors last fiscal year. But the students have now requested some, or have expressed some interest in talking with professionals who are working in the juvenile justice field to really discuss matters of equity, whether it be in policing or across the system. They're thinking about, what's being done to address inequities. And so kind of when I was talking to her, I get the sense that there's an opportunity for maybe more of like a panel where we have a couple of perspectives represented, but I think there's also interest in thinking about professionals who may be in this field or working in this field who had to overcome some of the challenges that maybe the youth have had to overcome and are finding themselves in this field to try to make a difference as well. So she's hoping to coordinate it by this fall. I don't know if we're going to be able to coordinate schedules that quickly, but that is an opportunity that we have as the JJC.
And I think that we were just looking to see if there would be interest from the state's attorney's office, from our office, in putting that panel together. Deb is smiling, I don't know. She can't.
I mean, can you hear me now?
We can hear you.
Yeah, I mean, we would help for sure.
So I think what we'll do is have Julia get back in touch with Dr. McCall and see what our timetable is. Yeah, sound good?
Mm-hmm.
Any questions from anyone else on that?
No, thank you for that. I'll follow up with her this afternoon as well.
Thanks, Marty.
Great. So that is all of our new business. Julia sent out the legislative updates. Oh, sorry.
Sorry.
She's going to send out the legislative updates, so everyone will have those. And then was there any other updates from any of our partners that they would like to discuss? Everybody is good? All right.
Can I just offer something? As a part of being the chair for the Child Youth Safety Committee for the Family Violence Coordinating Council, we do have a training team that we've trained for Teacher Institute days. And it's ultimately a supplemental training for mandated reporting. It kind of gives additional tips and things to look for as it relates to contacting the DCFS hotline, when to contact, what to look out for. We offer this training to any youth service serving organization. So it can be mentoring groups, sporting teams, anything of that nature. There are members from DCFS on the training team. So if any of your organizations want to be on our kind of marketing list so that you can be aware of when we're going to offer that training, if you want to have staff or your volunteers attend it, it is supplemental to the DCFS mandatory training. It is not in lieu of. But we found that teachers and school personnel like the presentation, and we've done it for other child youth organizations as well. So if you're interested in that, feel free to send me an email and I can get you on that list so that you can be aware of those upcoming trainings.
Thank you, Latanya. Anyone else? Okay, then our next quarterly meeting is January 13th. That will be a virtual meeting. So Julia will send out a Zoom link for that. And our next Board of Directors meeting is November 18th, also via Zoom. And then if I could just have a motion and a second to adjourn. Carter moved. Julia, and we can have a second?
I'll second.
All right, then we are adjourned. Thank you all for coming in person and on